Our first presenters are Kalila Durand and Shannon Evanchek. Kalila Durand is a project manager for the lead testing in school and childcare program. She has a Bachelor in Science and Geoscience at Midwestern State University. Kalila joined the TCEQ in 2022 as a natural resource specialist on the drinking water assessment team, where she dealt with the school and childcare portion of the lead and copper revisions and assisted with day-to-day operations of the lead testing in school and childcare program. Her current duties as a project manager include overseeing each aspect of the program and communicating with various stakeholders. Shannon Evanchek is a director at the lead drinking water program at Trupani, an engineering and consulting firm. She has a BS in environmental engineering from Georgia Tech and an MBA with supply chain concentration from the University of Tennessee. Shannon has worked for Trupani since 2016, and her duties include overseeing lead sampling and LCRR compliance programs. Please visit our workshop today at 10 o'clock for LCRI schools and childcare resources. And also during our Q&A after the presentation, please wait to ask your questions till a mic is available to speak into. Please welcome Kalila Durand and Shannon Evanchek.
We're here to talk about the lead testing in school and childcare program and how public water systems can get involved. This is a program provided by the TCEQ, and it is a program to test for and reduce children's exposure to lead in drinking water. You can email us at info@txleadtesting.org, or you could visit our website, texasleadtesting.org, for more information. Again, my name is Kalila Durand. I am the project manager here at TCEQ for the program, and I am joined by Shannon, who is the project manager at Trupani Incorporated. We are extremely fortunate to have Trupani providing this program for us here in Texas, as they have extensive experience providing this program in other states. This is a nationwide effort, and other states also have their lead program. Trupani has a lot of experience providing this program. Here's what you can expect from the presentation this morning. I'm going to give a brief overview, and then I'm going to hand it over to Shannon, who will talk about program benefits, achievements, key findings, and how water systems can get involved. And then we'll have some time for Q&A. So this is a free voluntary program that helps Texas public schools and state-regulated childcare facilities test for lead in drinking water and take action to reduce lead where children are served. Training, support, and sample analysis is provided at no cost to the participants, as well as technical assistance and ongoing support so that participants can successfully complete the program. All materials and instructions are also included and delivered directly to the participants. The guidance that we use for the program is the EPA FREETEAS guidance for reducing lead in drinking water in schools and childcare facilities. This is a training, testing, and taking action approach to reducing lead in drinking water. Funding for the program is provided by the Water Infrastructure Improvements for the Nation Act, Section 2107 Voluntary School and Childcare Lead Testing and Reduction Grant Program, or the WIN grant for short. This is also provided by the EPA. Before I get into the steps of the program, I want to talk about what we've done to garner participation in the program and increase program engagement. This is a voluntary program, and so we've done a number of things to get people enrolled. The first thing that we've done is direct outreach, that is directly calling or emailing the schools and childcare facilities. In doing the outreach, we've prioritized areas with a low-medium household income, facilities where 50% of the children receive free and reduced lunch, facilities that serve children 6 years and under, and Head Start facilities. As a result of this, we have 72% of schools and 85% of childcare facilities in communities that are below the state MHI. Other things that we've done are online trainings and educational sessions for anyone who's interested in the program, as well as taking part in conferences such as this one, other water-related conferences and educational conferences. Some of y'all may have seen our booths at the exhibits and heard some presentations from us in the past. And we also conduct program webinars and participate in external webinars. We also do social media where we post graphics such as the one on the screen, and we also have a program promotional packet. This packet we can actually share with anyone who wants to assist us in promoting the program. So that's going to consist of graphics like these and a template to send out a letter or email to your community or whoever you think should be informed of this program. So the first step of the program is to enroll. They can do this using our online enrollment form. And in this step, they're going to designate an SEC, which is a sampling event coordinator. As the name suggests, this is the person who's going to coordinate the sampling event. And this is also the person who we are going to be in contact with throughout the entirety of the program. ISDs and childcare agencies with multiple facilities, for this step, it can be streamlined, so they don't have to enroll each facility one by one. The next step is to complete the program training. This is a short video that goes through what lead is, the sources of lead, the effects of lead, and just gives a background of the program and states why we're taking this effort. After that is the notifying their community, step 3. This is where they will inform their community about lead, again, what lead is, the effects of lead, and let them know that they're participating in this sampling event. This step in particular we find to be best practice as it shows transparency between the facilities and their community. So their community can include the parents of the students that they serve, their faculty, their staff, even a building owner who's involved in decision-making processes. The next step is to complete their outlet inventory. This is where they are going to go around the facility and identify outlets for sampling. Of course, we encourage them to take samples from outlets used for drinking and fruit preparation. And then when that is complete, they move on to step 5, which is collecting their samples and doing their sample collector training. The collector training is another short video that goes through preparing for sampling, how to properly collect the samples, and how to actually ship their samples to the lab. These 2 steps, we are able to offer on-site sampling support. So this is where we can send out our field technicians to assist them and do the outlet inventory and the sampling process and shipment for them. We find this to be especially helpful for ISDs and childcare agencies with multiple facilities. The last step is receiving their results and taking action. They will receive their results and an action plan that we send out that's going to consist of some recommended actions that they can take based on the levels of lead that they find at each outlet. In this step, they also receive a certificate of completion that basically says, thank you so much for participating in this program and completing this program. They can share that on their bulletin board or with their community, however they like. Sampling for the protocols for this program meet the requirements outlined in LCRR and LCRI for school and childcare sampling. So we also use a 250 milliliter sample bottle. We do an 8 to 18 hour stagnation period. We do take first draw and the flush samples, and we do multiple rounds of sampling. And anyone can collect sample, any trained personnel can collect samples, whether that be school or childcare personnel, the LTSCC team, the water system, or a consultant. Again, like I mentioned, all program participants will receive an action plan regardless of the results that they receive, and this is going to provide options for remediation. Just something to note, the LTSCC program and the LCRI for schools and childcare facilities do not have an action level. The action level that is proposed in LCRI is for TAP monitoring, and that's the 10 parts per billion action level. On this note, I want to inform you all that WIN funding can now be used for remediation, and we've taken full advantage of that, and we have begun providing picture filters to the schools and childcare facilities at no cost to them. And we are also working on some more things that we can do to assist schools and childcare facilities with more remediation. So before I conclude and hand it over to Shannon, I want to go ahead and plug our website again, texasledtesting.org. This is where participants can enroll online, and people can also nominate facilities that they think should participate in this program. So if you know of any schools in your service area you think should be involved in this, you can go ahead on our website and nominate them, and we will reach out to these schools. You could also view our public results portal. So all results that we have from schools that have completed testing in the program is going to be posted on this portal and available for the public. You can sign up for webinars and view our past webinars. You can also just keep up with news and other information related to the program. You can schedule a meeting with us. If after this presentation you feel like you want a one-on-one at your leisure, whatever time works for you, whatever day works for you, we will meet with you. And you can just generally learn more about the program, learn more about the 3 Ts or the WIN grant, as I mentioned earlier on in the presentation. All right, so I'm going to hand it over to Shannon.
Thank you, Kalila. Can everybody hear me okay? Okay, great. So I want to talk a little bit about some of the program benefits and achievements. So we started offering this program in September of 2022. So we're coming up on 2 years of being able to offer this program to schools and childcare facilities across the state. The benefits of the program, as Kalila mentioned, this meets and exceeds all LCRR and LCRI requirements for school and childcare sampling. I'm going to say that one more time. This meets and exceeds all of the requirements for school and childcare sampling under LCRR and the proposed LCRI. I know everybody's focused on the inventory on October 16th right now, but there is a requirement to be offering sampling to the schools and childcare facilities within your service boundary, and this program can help you do that and save you time and money. It provides free sample materials, training, and lab analysis from a certified lab, and it's designed by a team that has a lot of experience doing this type of sampling. Like Kalila mentioned, this is 250 milliliter samples. It's different than the 1 liter 6-hour stagnation samples that you guys have been taking for compliance sampling. And so, we want to make sure that that protocol is followed because that's what the LCRR and LCRR requires, and that's what the 3 Ts program includes. And then again, we can provide technical and communication support. So what that looks like is we have a communications team led by our program enrollment coordinator, Catherine. I have her business card here, so if you guys want to get in touch with her, I have those available after the presentation. And then we have a helpline that's staffed, so if parents and members of the community have questions from the schools, they can call and get answers and talk to a real person. And again, that can be a way to save you all time because of those, phone calls and questions, there's support there. And then we have the technical staff as well. So, here today we have Brooke, Miranda, Kalila, myself, and Amy are all here and can answer any questions. And then we also have field technicians that have been traveling across the state and helping schools and childcare facilities collect samples. And then overall, one of our benefits of the program is to increase trust and transparency with the school and child care facilities and ultimately reduce lead in drinking water where children are cared for. So as Kalila mentioned, something that's new is the EPA grant that funds this program can now be used to purchase and support different control measures. And so right now, schools and childcare facilities that have completed the sampling can receive pitcher filters if it's an appropriate remediation tool for their results and their findings. Some achievements of the program so far, we have about over 3,000 participating schools and childcare facilities across the state. About 400,000 children are served at these facilities, and we have sampled and analyzed over 28,000 samples as of 2 weeks ago, and this is going up every week. So in terms of some of the findings of what we've seen from the data that's been collected and analyzed so far, first we analyzed some of the data in terms of reaching out to schools and childcare facilities. So there's over 26,000 schools and childcare facilities across the state. There also is, a lot of fluctuation in this. Childcares, close and open, and there is a lot of turnover. And so we're constantly refreshing this list to make sure that we have the most up-to-date and accurate information. For schools, some of our findings are that school districts tend to enroll collectively. So instead of reaching out to principals at individual schools, it's better to reach the school through their central points of contacts and try to engage with the entire district. And then this is kind of opposite for the childcare facilities, because the childcare facilities tend to be more individually owned, and getting in touch with the owner, whether it's a residential childcare facility or a non-residential facility, tends to be better. School districts also tend to like to talk on the phone or meet over, a Teams meeting or a virtual meeting or in person. Whereas for a childcare facility, the childcare facility owner is usually managing a lot of different responsibilities, and it's hard to reach them on the phone because there might be, screaming kids in the background. And so engaging with them via postcards and letters has been really effective to get them to participate in the program. And I did want to share those findings and tips, because if you all start to reach out to your schools and childcare facilities through the LCRR and LCRI work that is going to happen in the future, that can potentially be helpful. So looking at some of our program data, we looked at some of the data at, at different levels. Of course, we know there's no safe level of lead, in drinking water, but of course, 15 parts per billion historically has been a commonly recognized threshold. So when we're looking at that, we're seeing about 2% of the samples collected at schools coming back at 15 parts per billion or higher, and about 1.5% for the childcare facilities. And then overall across the board, we've seen somewhere in the ballpark of 20 to 30% of the samples having any detectable level of lead. When we're looking at facilities that have at least one location at 15 parts per billion or higher, we're seeing that happen, between 25 and 30% of the time for schools. So what that means is if we collect 50 samples at a school, we're likely, about 1 out of 3 times to see at least one location there come back at 15 parts per billion or higher. The good news about that is if there are several locations where there's no lead detected, a potential remediation tool can simply be removing that drinking water outlet from service and not allowing kids to drink out of it. And so we do encourage, low cost or no cost remediation solutions when possible, when there are alternative sources that show no lead detected. And then on average, through this program, the average number of samples that we're collecting is 30 at schools and 7 at childcare facilities. So again, going back to what's forthcoming with the LCRR and the proposed LCRI, what EPA is saying right now is that water systems are going to have to collect 5 samples per school and 2 samples per childcare facility. So you can see here from our numbers, we're typically collecting a lot more than that and can provide that to you all at no cost. So again, looking at our program data here by outlet type, so the 3 most common types of water outlets that we sample at schools are drinking fountains, kitchen faucets, and classroom faucets. And that EPA 3Ts sampling method that we're using of the 250 milliliters is really designed to be trying to capture any of the fixture level lead, sources of lead from lead solder, anything from, the premise plumbing. So that's definitely something that's important to educate schools and childcare facilities on ahead of time. So for drinking fountains, typically we see about 78%, have non-detect results. And then for kitchen faucets and classroom faucets, that's a little bit lower. So when we do see elevated lead levels, we tend to see it, more often from a kitchen faucet or a classroom faucet compared to a drinking fountain. That also includes water coolers, and sometimes those are filtered, which might be one of the reasons that we see, less lead in drinking fountains. So the last resource that I want to talk about today is the results portal. So the EPA WIN grant does specify that all results have to be made publicly available. So all of the data that we have collected is available for you all to take a look at if you go to txleadtesting.org and click the results button. You can filter on there by county, and then you can export to a spreadsheet, or you can export the entire data set and then do some filtering and look at the data within Excel once you have that as a spreadsheet. So the last thing that we want to talk about today is how the LTSCC program can help you all. So again, I know everybody's focused on October 16th, but I want to talk a little bit about what's currently in the proposed LCRI and what has already been outlined in the LCRR. So the LCRR said that water systems are going to have to offer to schools and child care facilities to collect point-of-use 250 milliliter samples. And so what the proposed LCRI, which again has not been finalized and could change, but what the proposed LCRI has said is this is going to be delayed. So LCRR said it was going to happen starting in 2025. LCRI is saying it's likely going to be starting in 2028 that you'll have to offer schools and child care facilities to sample. However, they have said that samples collected through a WIN program, which is the LTSCC program, after 2021 can be used to meet this requirement. So what that means is if you have schools and child care facilities that start to sample through our program now, that those then count and that don't have to be sampled again starting in 2028 when you make those offers. So we're encouraging everybody to start early, take advantage of the program now, because we can help you, one, understand the schools and child care facilities in your service boundary if you don't already know that, and two, save you time and money by doing the sampling now, get that sampling done for free through the state program, and have all of these resources available to help with all of the different communications and outreach efforts as well. So again, the LTSCC program is available now, and it's a WIN-funded state program. And we can also sample, even do more sampling for the schools and child care facilities if they're interested, beyond the 5 samples per school and 2 samples per child care facility that's required under the LCRR and proposed LCRI. So in looking at stakeholder engagement, so our program has really focused on trying to work with public water systems, trying to work with different state agencies, school boards, and child care facilities, because schools and child care facilities, if we call and say, we're calling from the TCEQ lead testing program, they're going to probably say, who's that? And they're going to be more familiar with, say, hearing from Austin Water or something like that. Like, they know you all, they trust you all. So working with public water systems to promote the program is really a win-win because of that. And so, we've been doing a lot of conferences, presentations, phone calls, and trying to collaborate in order to make this available and make this funding utilized. The program has worked with the City of FAR Public Utilities to hold a program information session for about 30 different child care administrators in and around the area. We also have these communication resources. So as Kalila mentioned, we have templates that you all can use. So again, you don't have to recreate the wheel. You can use these templates to reach out to your schools and child care facilities. And then our communications team can also help you customize it, or if you want something custom done for your schools and child care facilities, we can help with that. The last thing that I want to touch on is the sampling assistance. So we do have the free sampling and analysis available. We can do the sampling one of 3 ways. We can send a kit to the schools and child care facilities. They can review the instructions and the training and collect the samples themselves. Or we can send out our team members. Throughout the summer, we've sampled about 400 schools across the state with a team of 12 samplers going throughout the summer. And then the last way to do it is that you all could collect the samples. So we could send the kit to the school, and then you all could help them with the sample collection process. In terms of looking at remediation support, the team can provide free remediation support for water locations with detectable lead. We are currently providing the pitcher filters, but we're also talking to the schools and child care facilities to really understand and recommend the best remediation based on their results and the configuration of their buildings. We're also collecting information on what remediation has happened, if any, based on the results. So after they get their lab report and we explain to them, kind of what the lab report means and help them interpret all of that data, then we follow up and ask what action has been taken. So that concludes a lot of kind of the background information on the program. We are going to have a Q&A panel now. Both Kalila and myself will be on the Q&A panel, and then we also have Crystal Lindell from Austin Water. Austin's been a tremendous partner in helping encourage Austin ISD to enroll in the program, which they have, and we're about halfway through sampling all of their schools now, which is going to save Austin Water hopefully a lot of time and money for future LCRR and LCRI compliance. So with that, we will open it up for the Q&A.
Good morning. I have quite a few questions, actually. So you talked about, when they enroll, they need to provide a contact. So if we as PWSs are helping them out with that, can we be the contact for that? Or does it has to be someone from the ISD?
That's a great question. So the contact does need to be someone at the school district or child care agency, because we want to make sure that, they're getting the emails with the lab reports and everything. Mm-hmm. But, we are collaborating with water systems. So we could also, as long as we're coordinating with the school and with you all, we could also include you all on all of that information and make sure that you guys are looped in on that process. Sometimes we will do, either a phone call or a meeting at the beginning to help coordinate all of that. But regardless of if the sampling's happening through this program or for the school and child care sampling through LCRR and LCRI, ultimately it's going to be the school or the child care facility that has to opt in to make that happen.
Okay, so you also talked about notifying. Is that also something that the ISD needs to be doing?
Through the LTSCC program, notifying the community does have to happen from the school district or child care facility to let their parents and guardians know. It's a requirement of the EPA WIN funding, so they do have to do that. But ultimately, what we've seen is that it actually leads to better outcomes, because oftentimes when the notification doesn't happen and then someone finds out about the results after it's already been done, that's when we tend to see, some of the articles in the news with the headlines and everything about the school finding lead, because no one knew the testing was even happening. So we do have templates available in multiple languages that the school district and child care facilities can use to let their parents and guardians know that they're going to be doing the sampling.
So I'm going to assume that the inventory for the outlets, that's also on the ISDs.
That depends. It can be done by the water system. It can be done by our program technicians, or it can be done by the school or the child care facility. It is a voluntary program, so they get to choose the locations that they want to sample. And we encourage them to sample from anything that could be used for drinking fountains, kitchen sinks, for food prep, things like that. Under the LCRR and LCRI, there is specific guidance on what outlets they should select for the 5 locations for the schools and the 2 for the child care facilities.
Okay, last question, I promise. You talked about, receiving results and taking action. So we as PWSs, if we are, helping them out and we're involved, who is the one that is expected to take action? Because you also mentioned that there's not an actual action level for this. So what are we going to tell them if there's something? Oh, yeah, you're there, but what's next?
Yeah, that's a great question. Ultimately, the ownership is on the school or the child care facility, because, they're the ones that own their fixtures, their premise plumbing and all of the materials. We can provide them with guidance and technical support, and also this program can provide them with filters. But, remediation is really a spectrum, and it really depends. Sometimes if it's a classroom sink and they grab a sample from there and it's 30 parts per billion, and then they say, oh yeah, well, someone might use it for drinking, but no one really does, and there's a filtered drinking fountain in the hallway, what we could recommend there is, don't allow people to drink from it. Either remove that from service, or, post signs that it should only be used for hand washing and not for drinking. That can be a really effective remediation tool. So that technical support and guidance, our program can provide. But, regardless of LCRR, LCRI, or this program, the ownership is ultimately on the school and child care facility to remediate based off of their findings.
So if it's a child care facility or a smaller child care place and they're like, nobody's going to help us to fix this, so I want to opt out, what do we do?
That's kind of a two-pronged question. Our program's voluntary, so people do tell us no. We've had people tell us, I don't want to test because I don't want to know and then have to tell my parents. Sure, certainly. We hope by being able to provide remediation support, filters, and things like that, that we can help decrease that barrier to participation. But people, of course, are allowed to say no. It's completely voluntary. And then for the LCRR compliance, as it's written right now, what water systems are required to do is make 2 offers and document. So if they refuse to allow you all to test, that is that's their right to do that. But the effort needs to be there and documented.
So we have a question from the online audience. How does this program benefit the lead and copper line survey, considering that sampling is not an accurate method for classifying lines?
Yeah, so this program's completely unrelated to the inventory. This is just focused on school and childcare sampling, completely separate from the lead service line inventory. This sampling isn't being used to try and classify service line materials. It's completely unrelated.
Okay, thank you. And one more from the online audience. Explain WIIN grants.
I can take that one. So it is the WIN grant, Water Infrastructure Improvements for the Nation Act. So this is a grant that's provided by the EPA that provides funding for the program.
I was thinking about the question about how this is related to the inventory, which Austin Water is doing really well in its inventory, so we do have a lot of resources and space to think about some of these other things. My position was sort of created knowing that LCRR was coming, but then LCRI delayed it a little bit for the school and daycare sampling. So one thing I would like to point out is this, and this is what we're continuing to do while we're putting energy into it. This is real easy way to save your money going forward. So you might be like, oh my gosh, I just have this inventory to do. That's like the biggest thing I have to worry about right now. But what this looks like for us is just promoting the program. So if you could just define your boundaries, like figure out your schools, which I'm happy to talk to you about, but they're gonna present on, it sounds like, later. If you figure out your school list and you just have like a list of mailing addresses, right? And you have the resources to just push a notification, whether that's through a customer portal or adding it to your CCR or sending out a postcard with a QR code, which they're happy to provide for you. If you could just do that a couple of times over the next 3 years, like we're already halfway done with our schools effectively, because we did make those inroads with AISD and another school district. So we're like 50% done, right, with our schools. And then our daycares are a whole nother beast, but we're doing pretty good considering. And really all we've done is act as a liaison and push some paper out. So you're like basically doing what you would have to do in 3 years, except you can focus on your inventory and just send out a couple of mailers or add it to your CCR in the meantime.
And to add to that, I know it's really early for your lists, but as Crystal said, we're going to go through that in the workshop at 10 a.m., provide you with resources that you could use and how the program, again, can further assist you with building that list.
I just want to say real quick. So I did our list, which is about 500-600 daycares and I guess 500, I don't remember on the schools, but AISD was half of it, so that's awesome. And I will say, just like for context, I mean, it's basically, once you have a system, it's like a day's work or less. It's just, I mean, I did it like kind of plug and chug with spreadsheets and a couple of resources. So if, you know, and then you have that list, and if you have a billing department or, you know, somebody who handles that, or if it's just you know, you can get it done pretty fast. Check that box.
Okay, we've got some more questions from the online audience. How do we nominate a school for TCE to the TCEQ? The enrollment application requires information about the school and the administrator who will oversee the program. Can the TCEQ grant us permission to nominate our customer schools and list us as the overseers of the program after the TCEQ communicates with the school?
So we have a form online to nominate. So if you go to texasleadtesting.org, there's both the enrollment form linked and then a nomination form. So as a water system, you can go in and nominate your schools and child care facilities, and then we will reach out to them and say, hey, you've been nominated to participate in this by your water system. And then if they do enroll, you know, we can have a follow-up conversation with everybody, get the water system involved, get the school district or the child care facilities all together, and then figure out the best strategy for executing the sampling. So whether that's, the school district, maintenance personnel want to collect the samples themselves, whether the water system, wants to go and do the sample collection, or, if it's our program technicians, we can kind of coordinate any of those options after they enroll. It does have to be the school or childcare facility that signs up for the program, but there is that nomination form so that you all can, nominate them to ultimately enroll.
Here's one more. My PWS is owned by the ISD. We already take lead and copper samples. So if we get into this program, does that mean we have to take more samples?
Our relationship with TCQ on this program started because, quite honestly, we had a relationship with AISD. We knew some of their facilities folks, and they didn't want to enroll because they were already doing internal testing. So they were like, we have this program, we send it to this lab, it's not that expensive, no big deal. And TCQ approached us like, hey, we can't get AISD to sign up. What is going on? So we reached out and we had that conversation, honestly, maybe 2 or 3 times to be try to explain what the benefit and really emphasize the all the resources that exist that make it easy on them to just go above and beyond. So for example, TCEQ will sample all the taps in the building as opposed to the spot checks that the districts typically do. And they have found, not they, but schools in general will find surprises, I guess. And it's been great for them to go ahead and nip any of that in the bud. So even if they have an internal program already, this is going to meet the 3 T's for sure, because there is a lot of variation about how they're collecting those samples. This is very prescribed and in accordance with the rules that are forthcoming. And it's so much more comprehensive than what any PWS is obligated to do under the rules, right? The 2 or 5 samples versus all of them. Technically, you are not obligated to provide a pitcher filter, but if you were that PWS run by the school and you participate in the sampling, now you have all of these resources bought and paid for: pitcher filters, PR people, technical assistants. I don't know anything about plumbing. What do I do here? And I really want to applaud the program because just as a liaison, they are incredibly flexible, incredibly responsive. I tell all of my customers when I reach out is you will get a person when you call. I mean, it's very common. I just pick up the phone and I call and say, hey, how's it going? The school reached out to me. So the program is amazing as is, prepackaged, ready to go. So that's what I try to tell people who are we've already doing this. So hopefully that's helpful.
Yes, thank you. Got another one.
One more follow-up thought on that is sampling that's happening right now is typically the 1 liter sampling, and the EPA 3Ts is 250 milliliters, and we do see a lot of difference in terms of results just by changing that sample volume and stagnation time. So that's the one other thing that I would add, about why the EPA 3Ts protocol is different than sampling that might already be happening.
If a school or facility has a positive result, what is the notification protocol to TCEQ, the EPA, and parents?
Well, if results come back and there's lead sampling, there is a notification that goes out to the facilities. So the school will inform the community of their lead results, and we also post those results on our public results portal. We also receive the lab results, and then we take we provide remediation options to the school so that they can do what's best based on the results that they have at each outlet.
Yeah, I think sometimes the concern is TCQ going to tell my students and teachers the results before I get a chance to tell that story? And the answer is no.
No.
It will be online, and I think it's really interesting that search button is kind of down on the bottom. It took me a while to notice it, but anybody can pull the results eventually, but they will let the school know and let the school handle it first.
Definitely.
So yeah, that's a good question. I want to do a quick plug before taking this question if we have time. And I want to say that in our department, we are a large municipality, so all of the smaller systems will look a little different. But we have had a lot of fruit come from making contact with our public health department because they have a lot of boots on the ground. I saw that ours was just out like going door to door, talking to people about mosquitoes. So we have created a lot of opportunities to get that message out. Just because we talked to them and said, hey, we're gonna have to tell you about lead results in a couple of years. Who do you want those emails to go to? And they were like, oh, tell us about this program, and have done a lot of promotion for us as well.